My name is Irene Achom Oluka. I work for UNICEF, Uganda Country Office, as a child protection officer, but also a focal point person for alternative care. First of all, before my presentation, I would like to thank so much the regional office team, particularly Mona and Emily for their technical support in the preparation of this webinar. I also want to thank the Ministry of Gender, the development partners, UNICEF colleagues who have supported in the preparation of the webinar. My presentation is an overview of the care reform process in Uganda, where I'm going to highlight the achievements, challenges, and lessons learned. What is the situation of care reform in Uganda? Uganda has a total population of 34.6 to 44.2 million, according to the census report of 2014. Out of that population, we have over 56% of children who are below the age of 18 years. Out of that, 8.4% of children are orphans who are commonly taken into care, alternative care by different children's homes. Then we have 51% of children who are either critically or moderately vulnerable. Children in alternative care form about 19%, that is 4.8 million children in kinship care. Several civil society organizations are running foster care schemes, fostering small numbers of children every year. An estimated 40,000 to 50,000 children live in residential care facilities. That is presenting a scenario of about 50,000 registered unaccompanied and separated refugee children, most of whom are also in kinship or foster care. We've registered a number of challenges in the area of care reform in Uganda. Among many rapid rise in residential care facilities, there were 36 facilities in 1996, and that went high to over 400 by 2012. Many homes are run by churches and are set up without the government permission. The government monitoring shows that facilities often do not meet national standards. There's also lack of timely and accurate data on the number of children in residential care or those who are living residential care. We don't have national data on that, although different partners capture information here and there, but we don't have a national figure as of now. We also have an increase in intercountry adoption that was before the amendment of the Children Act. We had the increase from 2008 onwards. There was use of loopholes in the guardianship. So we realized 240 children from Uganda being adopted by US citizens in 2012, compared to 311 children over the previous 12 years. A study established, there was a study that was commissioned by Ministry of Gender, but supported by UNICEF, which was undertaken in 2014. It showed a number of malpractices in the intercountry adoption. There were negative community attitudes towards foster care and domestic adoption, which discouraged prospective foster and adoptive parents from caring for children. Sometimes there are also misperceptions that fostering a child will attract remuneration of some kind, which when not realized often kills morale for fostering children. Kinship carers are not fully supported and often have complex and extensive needs. In the recent past, we also saw COVID posing increasing risks for family separation, and besides other factors like poverty, violence in homes, less resources going to NGOs that are funding residential care. So we've realized generally diminishing quality of care. However, there are also achievements which have been registered over a period of time. In regard to legislation, there were efforts to put in place a national framework for alternative care in Uganda. It was drafted and it's pending approval. This national framework provides a continuum of care options, and it's our main document. Although right now it's not yet online because it has not been approved, but by the end of this year, we expect it to be approved. We also have the Children's Approved Homes Rules, which outline minimum standards for residential care. And these are accompanied by the assessment tool, which the ministry team usually uses for carrying out assessments of the children's homes. We have a national strategy on social protection and national parenting guidelines, which provide support to vulnerable families. We did amend the Children's Act and outlined the continuum of care, and also highlighted the importance of family preservation, and it closed legal loopholes on the intercountry adoption. In regard to coordination, there are various coordination mechanisms that have been supported, and these include putting in place the National Child Protection Working Group, the Alternative Care Task Force, and the National Network of Child Care Institutions. These coordination platforms have been very, very instrumental in ensuring that we have a coordinated information sharing, identification of critical issues around alternative care which need to be addressed. The information that we get from these platforms has helped us to do budgeting, do planning around alternative care. Last year, Uganda approved the Uganda National Child Policy. This policy is accompanied by the implementation plan, which coordinates efforts of different sectors within child rights mandate. It also has a coordination structure called the Child Wellbeing Committee, which is established at national level, but we also want to cascade it to the subnational level. Actually, beginning of this year, there have been dissemination meetings to popularize this policy, and also to make sure that the child well-being committees are established as soon as possible. Achievements around the workforce strengthening and training. The government developed the alternative care training curriculum in 2014, which has been used for training on issues of alternative care. In each district, we have the probation officer, and the office of the probation is responsible for providing services to children. So within that framework of probation office, we also have the social welfare officers who've been placed in specific districts, and there are also efforts at national level to strengthen the entire social service workforce to build their capacity to provide better care for children who are separated from family, and also to guide support for children who are living care facilities and need reintegration. In regard to the institutionalization, there are numerous projects which have been established to support reduction in residential care, many of whom are supported by USAID funding. We also have some children's homes which have voluntarily closed and transformed their facilities into schools and community play centers for children. We have also registered increased monitoring and inspection of children's homes by governments, homes that do not meet the minimum standards set by government have been closed after children have been reunited with their families. Actually, one of the key roles that UNICEF plays is to support the government to ensure that standards are observed in the homes, and we promote family-based care. There are also more achievements in relation to deinstitutionalization and family strengthening. There are a number of programs which have been funded by USAID, as I mentioned before, and supported by civil society organizations led by government, of course. There were programs targeting the institutionalization of orphans and vulnerable children in Uganda. This resulted in reduced household and child vulnerability and supported the reintegration of 1,743 children, mostly from the residential care. There was also another project which was targeting economic strengthening to keep and reintegrate children into families. This piloted economic strengthening activities with 611 families which were at high risk of separation, and with the families of 89 children who were already in residential care being supported. There was also another program for keeping children in healthy and protective families. This program included or adapted a parenting program from South Africa to support the reintegration of children. In regard to foster care, several civil society organizations have successfully established foster care, including for refugees, street-connected children, and abandoned babies. We also, in addition to this, have established the foster care standard operating procedures and guidelines, which are being rolled out this year. In fact, UNICEF is putting in a lot of focus this year to roll out the foster care guidelines. The civil society organization called the Child's Eye Foundation have also trained 190 foster carers, of which 92 have been approved by government. We actually applaud so much the model that is employed by the Child's Eye Foundation in the institutionalization and reintegration of children, because it's more sustainable. It's a more sustainable approach, which should be promoted. In terms of adoption, we have experienced closure of legal loopholes in the inter-country adoption, and work to ratify the Hague Convention is also underway, but the loopholes in the intercountry adoption has been closed when we amended the Children's Act. And with that, we have experienced a number of Ugandans adopting children. Uganda's Adopt campaign, led by government with the support of civil society organizations, has led to the adoption of 60 children by Ugandans over the last 3 years, which is really a very good achievement. We learned a number of lessons through this process. We've learned that care reform is possible, but takes a gradual process to achieve it. And we hope that with the child policy coming in place, which is seeking to harmonize the coordination mechanisms, we believe that we shall achieve more. It also involves thorough preparation of both families and children, including the surrounding communities where the child will be reunited and reintegrated. This, together with the efforts I explained earlier on to strengthen the social service workforce at national and also subnational level, we hope that with increased capacity of social service, then we shall achieve much more, especially in regard to deinstitutionalization and also sustaining the capacity of the families to be able to take care of their children. Because as I mentioned earlier on, social welfare officers have been deployed in some selected districts to demonstrate that when you have additional capacity in social service workforce, you can achieve more results. So we also hope to do an evaluation of that approach, and we're advocating with government and also other partners to ensure that that approach is adopted by government, but also other partners could take that on. And so we believe that when we strengthen the capacity at sub-county level, then we'll see more children returning to families and staying in families, because we're also advocating with the funders of the care institutions to support the family, support economic activities within the families so that they can have better capacity to care for their children at home. So family support and strengthening is really key in deinstitutionalization and reintegration of children. Thank you very much.